Hi, my name is Stacy Harpster. I'm an RN and currently enrolled in the RN to BSN program at Bon Secours Memorial College of Nursing. Today, I'm going to be demonstrating the skill of performing an electrocardiogram. An electrocardiogram is a recording of a patient's electrical heart activity. We perform EKGs for various reasons. One of those reasons would be to evaluate for ischemia in a patient who presents or complains of chest pain. We also perform EKGs for abnormal heart rhythms or arrhythmias. Additionally, patients who have implantable pacemakers routinely undergo EKGs to assess for device functioning and to ensure that it's working properly. Also, we perform EKGs preoperatively on patients to assess their cardiac risk of adverse events during surgery. So let's get started. Of course, before we enter into the patient's room, we're going to ensure that we have washed our hands. We're going to introduce ourselves and explain the procedure that we're going to do. Ordered cardiogram. The activity of your heart. Going to perform that now. Can you please verify your name and date of birth? Wonderful. I'm going to go ahead and put your information into my EKG machine over here. Now we're ready to get started. Mr. Jones, I'm going to remove the gown covering your chest for the EKG. We're going to start with placement of V1. That is going to go on the right side of the chest at the fourth intercostal space. Next, we're going to place V2, which is in the same position as V1, but on the opposite side of the chest, on the left side. We're going to skip V3 and move to V4. V4 is placed at the mid-clavicular line at the fifth intercostal space. Now we will place V3 between 2 and 4. Next, we're going to place V6, skipping V5. V6 is placed in the mid-axillary line at the same level as V4. Then we'll place V5 between V4 and V6. Now we're ready to place the limb leads. You may notice that different people place limb leads at different locations. As long as the arm lead is placed between the shoulder and the wrist, that is not a problem. We do want to make sure that the leads are at the same location on both sides of the body. For example, we would not want to place an arm lead in the upper arm on one side and then on the lower arm of the other side. For the legs, the leads can be placed anywhere between the thigh and the ankle. Keeping in mind again that they just need to be at the same location on both sides. Now that our electrodes are placed, we're ready to attach the leads. The leads are labeled and we are simply connecting them to the electrodes that we placed. Once all the leads have been placed, you should see a heart rhythm on the EKG machine. Artifact is not uncommon, but we want to try to reduce that as much as we can. It's important to ensure that the patient is laying still during the EKG. Mr. Jones, I just need you to lay still until I tell you otherwise. All right, we're all done. So now we can print the EKG recording from the machine and remove the leads and electrodes. If possible, we want to make sure that we are completing EKGs with the patient in the supine position, lying flat or in semi-Fowlers. If the patient is unable to tolerate those positions, then they can be sitting, but we prefer to try to lay them down if possible. Special considerations and things to keep in mind that can alter the results of the EKG have to do with either anatomical abnormalities, so if the chest wall is anatomically altered, or if the heart position is different, then that may affect the recording of the EKG. Also, obesity, pregnancy, presence of ascites can also affect the results of the EKG. As I mentioned earlier, we want to make sure that the patient is lying still, and so movement can also affect the results of the EKG. We also want to ensure that the patient has not exercised or smoked just before the test, as those things can also affect the results of the EKG. Common mistakes in performing electrocardiograms are generally related to lead placement. Also, mistakes could be made because of the connection between the skin and the electrode. We want the skin to be dry. So if patients have been sweating or diaphoretic, we want to wipe the skin to make sure that we're getting a good connection between the electrode and the skin. Also, men who have hairy chests may need to be clipped to ensure a good connection between the electrode and the skin. There really aren't any risks or complications associated with an EKG. If anything, the electrodes can cause a skin rash, which is why it's important to take the electrodes off and remove them at the completion of the test.